Hello, it's Paul Baylis, one of the A&E consultants here in Garvan Hospital in Derry, and I'd like to get a message out there today, if I could, about discharging patients from hospital. You might say, well, hang on, you just told me you're an A&E consultant. Why are you interested in discharging people from hospital? Are you not the guy at the front door, not the guy at the back door? Well, in truth, it really matters to the emergency department if people are delayed in their discharge from hospital. Last week, on one day, I had 52 patients waiting for admission in the emergency department. Meanwhile, in the hospital, there were 50 patients who were fit for discharge, but weren't able to get home for various reasons. And I need your help in trying to get patients home. When the situation is that I have 50 patients in the emergency department, I don't have an emergency department. I have a big room full of 2 wards of acute patients waiting to get in. And it's very hard then to provide an emergency department service. I only have 27 cubicles. You can imagine when I have 50 patients rammed in there, it's very hard to actually care for the new patients that are arriving by ambulance or coming in through the front door. What could you do to help us, to help provide a safe emergency department service by getting your relatives home as promptly as possible? Well, there are 3 things really. The first thing is, if your relative, should I say, is fit for discharge, then please, if you could come and lift them from the hospital at the first opportunity. That clears the bed. It means I can get another patient up from A&E. It means I can get another patient out the back of an ambulance. The second point is, if it's an elderly relative perhaps and a care package to a nursing home's outlined, it might not be your first choice of nursing home, but it's a safe nursing home. Please, we have to ask you as a family to support us to get your relative out of the hospital bed into the nursing home placement so we can free up a space again and move somebody up from A&E. And finally, it might be that for an elderly person there's a care package is necessary. And not all the elements in the care package are in place, but please, if you could work with us and help support us by taking your elderly relative home and helping out for those few days it will take to get all of the pieces of the jigsaw with you, that will be a massive help. Because every patient moved out of a ward means one more patient moved out of A&E, means one more patient out the back of an ambulance. We are on our knees in A&E most of the time, and we need the public's help and support in safely getting people home as soon as we can.